Thank you all for coming back. I know it's getting a little late. This is our 10th class of the meeting. Michelle has graciously joined us on her day off on Saturday afternoon, and we're so glad that she did. Sandy, do you want to go ahead and introduce her, or do you want me to do that?
You bet. I'm happy to.
Okay.
So welcome, Michelle, and we want to thank you and, of course, Starkey for your tremendous support of WHS. You've been like a rock to us over the years, and we really appreciate it, and certainly the support we get with the donation of the hearing aids for our auction. So thank you very much for that. For all of you, Dr. Michelle Hurley is a senior education and training audiologist at Starkey Hearing Technologies. She has over 20 years of experience in the industry. She spent the first 7 years in clinical audiology and the past 25 years in a variety of roles, including manufacturing, training, sales, and technical support. And she has presented on a variety of topics at numerous state, national, and also international meetings. She earned her master's in audiology at North Texas State University and her AUD from the Arizona School of Health Sciences. So thank you so much again, and I'm happy to turn it over to you.
Thanks, Sandy. I appreciate it. And I really appreciate the opportunity to be able to be a part of this meeting. Coming to you from Dallas, Texas, and I certainly have had a lot of opportunities in the past to meet with the wonderful folks in the Washington State area, and I wish that I was there and I could be there with you all in person. I'm sure it's a lot cooler there than it is here.
Michelle?
So I'll go ahead and get started. One of the things I do want to mention as I get started with my presentation is that there will be time at the very end for questions and answers. So if you do have any questions, please go ahead and hold those to the end, and we will make sure that those get answered. So
Michelle?
go ahead and get started.
Yeah, Michelle, you're a bit muffled. Is your microphone?
Let me see if I can.
That's much better.
Is that a little bit better?
Yeah.
Okay. I'll kind of hold my phone up. I wanted to use my phone so that I have a video with audio, and if I plugged in my headset, that would eliminate that audio. So I'll go ahead and hold my phone a little bit closer.
Thank you.
You are welcome. If I can get my mouse to catch up with me. There we go. My mouse took a day off. One of the things that I think we have seen over the last 6 months or so is this amazing change that we have certainly experienced worldwide, and the impact that it has had on our professions as well, and the closures of offices, and that concern about where we as hearing professionals kind of fall in that essential services kind of aspect. And as everybody's come back into their offices and try to get back to normal, how do we do that and provide that exceptional care that I think we've all been known for, and do it in a safe and responsible way for our patients? Well, I think there's a lot of reasons on why this is a topic that is very important in our industry. There's a lot of contact that we have physically with our patients, and a lot of close interaction, and so that's why infection control has always been important for us. But I think that that has really risen to an entirely different level in 2020. I always like to kind of start out with the definition of infection control, because I think that it's really important that we understand what the objective is with with this whole concept. And infection control really involves the development, the implementation, and the consistent execution of procedures that are designed to reduce the risk of infection control or infection spread, in the workplace, particularly a healthcare workplace. And I think consistent execution is really a key term there. That's because, these are, protocols and processes that we need to be, consistent with performing day in and day out, and, make no exceptions with, particular patient that may be in front of us that is asking us to maybe kind of alter what we do, on their behalf. And so I think consistency is key for success. And, the concept of infection control is certainly not new, but it is something that, its relevance kind of reemerges when we have disease that kind of arises to the top, if you will. And certainly that's something that we have experienced in 2020 with, an entirely new virus, the coronavirus that has, appeared. And so, we're in a new reality now, but the fact remains that this topic is always one that is very important. And I think that, is seen in the fact that it is a requirement for your licensure. Well, why do we, have to think about, the spread of disease? One of the things that has really been a key reason for that is the, travel, that we have all kind of changed our behavior over time. A number of years ago, even humans weren't nearly as mobile as they are now. And, currently, we have the ability to, travel worldwide quite easily. And, that is a lot different from, 100 years ago, where people very rarely left their communities. And that kept diseases kind of confined in those cases as well. So, now with our ability to, kind of move all over the place, it means that, those, potential germs and bacteria and, potential spread of disease can certainly hitch a ride and travel from, one corner of the world to another. And, as we have certainly seen 2020, we don't always necessarily know where the person that may be in front of us, whether that's in our office, in the line at the grocery store, or wherever that may be, has been, and the impacts that that could have on the spread of disease. So there's, a number of diseases that, have had a key, impact on the concept of infection control, and none more so than the AIDS virus or HIV, which was really kind of the catalyst for our, approach to infection control, especially, here in the United States. That disease, once we, determined how it was, spreading in especially in healthcare types of settings, really was that change that took place in the development of, policies and procedures that the government established for, especially healthcare workers to protect themselves and others. So it was really key in kind of changing the way we approached infection control. But you have other diseases, such as H1N1, kind of commonly known as the swine flu. It's a great example of, the variety of flu viruses and how, those change from one year to the next in terms of which one is kind of, predominant in our communities. And the fact that, we have vaccinations for the flu, but they don't always necessarily, focus on, maybe the type that kind of rises in our communities. And, so swine flu was certainly one of those that had some significant impact. Measles, I think, is very interesting because, it wasn't that long ago that this disease was considered to be eradicated in our own country, and yet it's really had a resurgence in recent years. You've probably heard some about, the resurgence of measles in the news, and there's a lot of reasons for that. Vaccination opinions, and again, that movement and travel, and that certainly gets us to 2020 and COVID-19, where we had this little tiny virus. Thousands and thousands of these could fit on the head of a pin, and yet it has completely upended the world in so many ways. In terms of the loss of life and the impact that it has had on the economy and so many individuals' livelihoods. So, I'm sure that, when we were ringing in the new year in January, no one could have ever expected that we would see the kind of impact that we have because of this disease. So we're really kind of in an entirely new normal. While you probably had, hopefully, some infection control strategies, in your offices, you've probably, as you've come back to work or, modified your plan, really had to change things up and think about, the introduction of curbside services and telehealth and, changes in, personal protection equipment and all these things that, really, have not ever, been a consistent part of our activities, and now they're our new normal. So I want to show you a quick video that I think really kind of brings home, the challenges that we face in terms of the potential spread of disease. Oops. See if I can get these guys fired up here. Apologize if you're not hearing any sound. Usually there's some music that goes along with the video. So I think this video is really, a good demonstration of the risks that are involved in, moving about our workplaces and, many of the locations that we, may go throughout the course of our day, and how important is it that we really have a consistent strategy to how we're going to approach, infection control and protecting ourselves, our patients, our coworkers, and our families, of course. So one of the things that I think, we really have come to be aware of is the number of comorbidities that we see alongside hearing loss. There are so many health conditions that we see concurrently with an individual that comes into our offices to seek help for better hearing. Of course, we know that, tinnitus or ringing in the ears is one of those. But, we also know that there's a direct correlation between hearing loss and so many of these conditions that we see displayed here: cardiovascular disease, of course, balance. We know, diabetes and, cognitive decline. And so, it's very likely that, the individuals that are coming to see you for better hearing are also dealing with one of these other conditions. And we know that many of these conditions have been, high risk for the spread of COVID-19. And so, I think is very important that we as hearing professionals, really be cognizant of that tie-in to, hearing loss and these other conditions and the greater risk that means in terms of COVID-19. Of course, the most typical population that we are seeing throughout the course of our days tends to be the elderly population. And we know that they have, much, greater risk of, COVID-19. And there's a lot of reasons why, that, potential virus and many others are, at, such high risk for this patient population. And that's, their weakened immune system. Over time, our immune system kind of declines. We have things, that are, anatomical and functional changes, our thinner skin and, balance issues, making you greater risk for a fall. And we know that, There are many other health conditions that can, come as a result of that. And so that really, puts the population, again, that we are seeing most consistently in that high risk category. So I think it really, speaks to our need to be very focused on our infection control strategy. If you think about, all of the daily activities that we have, whether it's, as we leave our homes and, go about our business, in our own workplaces, or we go into stores and other facilities, there's a lot of risk around us in terms of the products that we come in contact with, the things that we touch, and, those common surfaces, buttons and doorknobs and railings, all of that is a great potential to be, a carrier of disease. And so, we don't know who touched those before us. And so we really need to, again, be very cognizant of how we're going to manage the surfaces in an environment that we really can control. And that certainly is our workplace. And we know that we come in contact with a lot of, tools and equipment throughout the course of our business days, and very often those objects come in contact with multiple professionals. And so you may have several people using the same audiometer, and certainly doors and pens and those types of things. And so we really have to be thinking about all of those objects that are in our workplace, how we can maybe minimize the contact that that we have, and certainly limit that to hopefully one person, if at all possible, or clean and disinfect in between uses. And also, if we think about some of the services that we provide and the risk that can be involved in those, such as serum and management and taking impressions, and the potential that there is to nick an ear, and that certainly is a open invitation for the spread of disease with that particular individual. So it's very important that we recognize the seriousness of what we do throughout our business days. So there's a number of ways in which diseases are transmitted, and so we're going to talk about each of these four categories: contact, vehicle, airborne, and vector-borne. The first of these is contact, and there's two options. There's direct contact, which means that there's no intervening persons or barriers. So that potential for disease is spread directly from one individual to the next. And shaking hands certainly is a great example of that. But the second category is indirect contact, and this is where those infectious microbes are transferred from a secondary surface. And some good examples of this in our work environment would be if you are performing otoscopy and don't change out the tips, or if you were performing a listening exam with your listening stethoscope and don't clean that tip and disinfect before you listen to another hearing aid. That has the potential to be that indirect source of transfer for those infectious microbes. And droplet transmission is another option. This is the one that we actually see is the most common form of transmission for COVID-19, and that's where those particles are expelled by coughing, sneezing, and talking, and then they land on a surface. And there's certainly been a lot of data about the distance in which these particles can travel, and it's really kind of disconcerting to think about that range in which they can travel. And so this was kind of that root of our 6-foot social distancing concept that was kind of established, is that droplet transmission. Next, there's vehicle transmission, and this is where there are substances. Cerumen, of course, is what we would be most familiar with in our own offices, but this is also the way that contaminated food, water can also transmit disease. So that means that we need to be thinking about cerumen and its role in compliance. Airborne transmission is where the air is going to be the source from those little minute dust type of particles. And while COVID-19 was thought, originally to be, solely droplet transmission, there have been some discussions that, airborne transmission and those very, very fine particles can also be a source. And so, there's, one of the things we've seen with COVID-19 has certainly been the change almost daily in terms of some of the information that's out there. And, airborne transmission and its potential role is certainly one of those. And finally, there's vector-borne transmission, which is where insects or animals are going to be that source of that transmission. And we can think of, some diseases such as, Zika and West Nile, certainly as being some great examples of vector-borne types of diseases. Oops, my apologies, I hit the wrong button. You'll give me just a second there to fix that. All right. Pardon the interruption there. One of the things that we have, seen is that there are, a number of ways in which disease can be transmitted. And, there are 4 that are probably certainly most common in terms of risk in our offices. Eyes, ears, nose, and mouth, so those typical body orifices. And all of those really have been, at least eyes, nose, and mouth have been a key source of potential transmission with COVID-19. And so, that's why we see so much discussion about, the wearing of, face coverings and that including, eyes as well. And that's because of the great risk, certainly with COVID-19, but they do tend to be key routes of transmission for many, many diseases. Now, I think this is a very interesting slide. It's because, the external ear canal is classified as the most prone to infection of any other skin surface. And I think it, may be easy to kind of not to recognize that. But if you really stop and think about that skin in our, external auditory ear canal, very, very thin, doesn't get a lot of exposure to, surfaces and also, it is very, very sensitive and very easy for it to be penetrated, when we're doing things such as, cleanings and impression taking. And so I think, it is quite easy to see why it might be so prone to infection. Another thing that, we have to certainly keep in mind is that potential of cerumen to be that disease transmitter. And if you think about cerumen, if you look at it, you can't necessarily tell whether it is infected just on visual inspection. We know that it tends to be kind of, dark and moist, even in its natural state. And so it's hard to tell whether it might have been impacted by, blood or, other types of, infected bodily secretions. And so we really need to be treating it as a potentially infectious substance for that reason, because we can't just look at it and recognize whether it is harmful or not. And there was a really interesting study that was published in May, which seems like an eternity ago now. But the National Institute for Health did a study looking at loud talking and in close proximity and the potential risk that had in terms of spreading, droplets, especially those that might be contaminated with coronavirus, and the distance that they could travel and the thousands of these droplets that were out there with loud talking. And loud talking was defined as 85 dB at a range of about 12 inches. And these droplets could kind of hang in the air for up to 14 minutes. So that's kind of a disconcerting thought, isn't it? And, I think it's a great reminder of, the importance that we as hearing professionals really kind of play in, providing better hearing, which can certainly reduce the loud talking of the hearing aid wearers themselves, and can, certainly play a role in their, loved ones and contacts not needing to speak louder, as well. And, so we know that because that elevated voice is so common in untreated hearing loss circles, this I think is a really good reminder to us of the importance of what we do in providing better hearing. when you think about all the products that we're working with on a daily basis, and the contact that they have with us and certainly with the individuals that are using them, there's a lot of potential in terms of the products and the surfaces themselves. And it goes beyond hearing aids. Now we have so many great accessory options. We use our, smartphones as an accessory essentially. And so that means that there's just that much more, surface area that has the potential and risk to spread disease that we need to be thinking about how we're going to manage it appropriately. So we talked about, the hearing products, on the previous slide, but, one of those certainly that was mentioned was smartphone. And, I know when I certainly got into the industry, we didn't have smartphones, and now they are pretty much everywhere. I'm using it to communicate with you, and we all kind of carry them everywhere we go. Sometimes places that we probably shouldn't take them, of course, and that means that that's a surface that is at high risk. And there's been a lot of study and information about the disease potential on the surfaces of our phones, because they don't probably get cleaned nearly as much as they really should. But also when we think about, other, objects that we use on a frequent basis, such as, what we use in terms of forms of payment, credit cards and cash being, made of, fabric, which the fibers are very likely to kind of trap and hold on to potentially, germy, things. Then we need to be thinking about that. And I know there's certainly been a lot of push towards contactless, payments since the pandemic started. Credit cards, are certainly at risk as well. Plastic can hold on to the virus for some time. We know that when we use credit cards, those get, passed between, several people, whether it's, your wait staff or, even your front office or you yourself as you're doing transactions with your patients. So, again, thinking about, contactless and how maybe we can incorporate that in our offices, I think is a very wise approach. Also, there's been some study looking at, the use of lab coats and white coats and the potential that type of, fabric that, is worn consistently in a healthcare environment, might have in terms of the spread of disease. And, some studies have actually looked at, how frequent people are washing their lab coats, and find that it's not happening quite as often as it should. And there's been some definite high risk germs and bacteria that have been found on the surfaces of these coats. So if you are using a lab type of coat, I would certainly recommend that you launder that very, very consistently, or change it out consistently because of that fact. So here is your first keyword for my session. That keyword is going to be virus. So if you will, private message that to your moderator, that will be your, information to keep you in the loop for the continuing education for this particular session. So your first keyword is virus. Not a surprise, I would imagine. So let's talk a little bit about ways that we as hearing healthcare professionals can actually work towards preventing the spread of disease, how we can protect our patients, our staff, and ourselves in our work environment. One of those things that is critical and that I hope you already have established in your practices is a written infection control guideline. It's something that is required by the OSHA organization that manages occupational safety and health. And any healthcare facility is required to have one, and it must include these 6 sections. And these 6 sections are the categorization of employees, the HBV or hepatitis B vaccination, training plans and training records, work practice controls and implementation protocols, emergency procedures, and post-exposure evaluation and follow-up. And kind of in the interest of time, I'm going to focus on the two that are probably most highly variable depending on practices, and that's going to be the categorization of employees and work practice controls. The others are quite consistent in terms of who is recommended that they have that hepatitis B vaccination and how all of those records should be maintained and all. So we'll focus on the two that really have the highest potential for differentiation from one office location to the next. So one of those is that categorization of employees, and OSHA recommends that anybody that is in an office be categorized, and there are three categorizations specifically. Category 1 is clinical audiologists, anybody that has that high potential to have exposure to blood type of transmissions. So most likely this is probably going to be pretty specific audiology roles in a hospital type of environment, intraoperative monitoring and such. Category 2 is for audiologists and hearing instrument specialists, student interns, that many of us work with. Anybody that works in that clinic, whether it's patient care coordinator or anyone else that has patient contact at all. So if you will be interacting with a patient face to face and exchanging materials, you fall into that category 2. So I would say that this is probably the vast majority of all of us. Category 3 is your administrative staff that is not having any sort of patient contact whatsoever. The rules are anybody that falls into category 1 and 2 is required to practice infection control procedures. But I would think that, in the day and age in which we are right now, that if you do have individuals that fall into that category 3, that they need to be adhering to those procedures. At the very least, be aware of, the protocols and plans that you have in your practice. But I think that it's a good option right now for everybody in the practice to be participating in infection control. The second of those kind of highly variable, aspects of that written infection control plan is work practice and engineering controls. And these are highly variable because everybody's offices are kind of established and set up a little bit differently, and not every office performs exactly the same type of task. Engineering controls are part of that, that work practice control strategy, and they're specifically focused on isolating and removing bloodborne pathogens from the workplace. And so, this may speak to how you store the items that are reusable. If they're disposable, that's one thing. But if they're going to be reused from, one patient to the next or one day to the next, how are you going to sterilize them? Where are you going to do that? Do you need to label that area as hazardous because you are working with, different types of, chemical related materials? Work practice controls are those that are very profession specific. So, there will be different work practice controls based on the different type of healthcare that you're performing. And, what they really boil down to is, how your practice is really going to, manage the use of personal protective equipment, how you're going to establish procedures for various types of, functions in your office, such as, cerumen management or otoscopy or taking impressions. And so there needs to be a work practice control that relates to every aspect of that, and that's where it can be highly different from one practice to the next, depending on what types of procedures you are performing. One of the things that the CDC has established guidelines for is universal precautions, and this is how we're going to protect ourselves and others in terms of the use of personal protective equipment, washing our hands, taking care of the surfaces and the environments, what types of instruments need to be sterilized or disinfected, and also how we're going to dispose of waste in our environment. So it is very, very specific, and this is really the hallmark of infection control is a universal precaution plan. So the first, aspect of this is personal protective equipment, or PPE, and I'm sure that, back in 2019, we probably would never have even thought about that, that PPE, as a big topic, but nonetheless, that has become one in 2020. And we know that depending on our offices and our focus, maybe we used masks in certain situations. Hopefully we used protective glasses when we did things like modifying hearing aids. Gowns certainly are recommended in typical cases where you may come in contact with more splash types of materials. And gloves were always a really good idea when you're dealing with chemical materials and all. But one of the things that it's really important now is that we kind of revisit the role that any of those may play. While we might have used masks and safety glasses relatively consistently, now maybe we need to step back and look at the use of gowns in our workplace that maybe in 2019 we didn't even really think about that. So masks have certainly become the must-have accessory, unfortunately. And there are a variety of types of masks out there on the marketplace. And we know that there certainly have been shortages, and that has, played a huge role in how we, can procure masks and what we can kind of use, whether that's in a business work environment or even, in our daily activities, depending on your, community. You may be required to wear masks, when you leave the house and go into any sort of public space. That's, pretty much the way it is here in Dallas, Texas. So, it's kind of becoming, again, that must-have accessory for myself. So, there are a number of masks. The ones that are, probably the best in terms of protection are going to be those N95 respirator masks, because they're going to protect from the vast majority of those droplets. That 95 is essentially, they're protecting you from 95% of those droplets, penetrating. These masks certainly are, the ones that, first responders and medical professionals should be using, and consequently they have been, as well as some of the others, at high demand and very, very difficult to find. And in our type of work environment, I would certainly say if you have access to an N95 and you are either a higher risk individual yourself or are doing things that are a higher risk for the patient, that it would be advisable and ideal if you can use an N95 respirator type of mask. Surgical masks, very, very common. These are the ones that they're, typically kind of blue or white, and they are, very protective. Certainly not as protective as an N95 respirator, but they're going to do a good job in most cases. Cloth masks have certainly, had to kind of step up and become quite common, and that's because of the, shortages that we saw for some of the more standard type of surgical masks, and certainly those N95s that were, supposed to be kind of kept for those first responders. So, cloth, you'll see those certainly, being sold quite a bit online. You may have some that you make yourselves. You may have, friends that are kind of producing those as a, gift to society. One of my best friends actually been doing that, so she's been my source of a lot of my cloth masks. They've kind of had to become used frequently because of the limitations to access to the other masks. And no mask is going to totally block the virus, but it really does provide that added layer of protection. And if we're using this in conjunction with the other strategies such as social distancing and hand washing and how we're supposed to be protecting ourselves, it's a great way. And we've continued as, this all has, continued to evolve, seeing that, there's been a lot of study and demonstration of the benefits that masks, especially certain types of masks, can provide. So when we think about those cloth coverings, we know that there's a lot of different options, and certainly the CDC, when they didn't originally, recommend them for almost every, use case, have changed that story. And, again, many communities have established mandates for the use of, some sort of face coverings, meaning that cloth has kind of become very popular. There's a couple of things we need to be thinking about when we look at the use of cloth face coverings. They need to fit snugly and comfortably, especially, over the nose and down underneath the chin. They need to be able to be secured in a number of different ways. And it's important, if at all possible, that they have multiple layers of fabric. The more, we can kind of place a barrier between, what is being projected from us as the speaker, the person who's coughing or sneezing, the better it's going to be for everyone. And, when we think about masks, we're really protecting everybody else around us by the use of these. They do need to be, breathable. Certainly, I know that's been one of the challenges, with the use of face masks, and certainly one of the pushbacks on them is that restriction that they do provide, especially if they are more protective and provide multiple layers. It's ideal if you're using a cloth face mask that they could be routinely laundered and machine dried so that you're cleaning those consistently, and that should be happening very, very consistently. There's been a lot of discussion, I think, even in this past week about the use of gaiters and whether you should use a gaiter or not use a gaiter. And, I think that, again, thinking about, the construction of it and does it have multiple layers is a big part of whether it's appropriate or not. And I saw a really good story about, a great way to kind of verify the effectiveness of your face mask that you're using is if you can or can't blow a candle out. If you can't blow a candle out, then that's a pretty good level of protection. If you can blow out a candle through that mask, then, you might want to consider something that has, more layers and is more protected. And of course, we have heard a lot in our professions about, the impact that face mask wearing has had on, speech, understanding, especially for individuals with, hearing loss. And, we have seen studies demonstrate that it has an impact on, understanding to a varying degree. Depends on the type of mask that, the N95s have, the potential to have, I think, up to 12, or so dB of, reduction for those high frequency speech consonants that are so critical for our speech understanding. And it's a little bit less so for the surgical and the cloth masks. So, they all have a negative impact on speech understanding. And that's why I think it would be wise if we as, hearing professionals investigate the use of clear face covering options when we're, communicating with our patients, and maybe even, providing, access to those as a service for some patients as well. I've seen some practices do that. And there are certainly a number of sources for these clear masks. One of those that has recently received FDA approval is the Clear Mask company, that first, website that you see there. And so, I think, having that FDA support has been really important. I know as I've taught this class over the last number of months, before that FDA approval was received, which I just heard about this week, that was always a big question, about, that approval. So good to know that one of those has kind of cleared those hurdles with the FDA. And there certainly are quite a few options. It's really been interesting to see the ingenuity of people and kind of, seeing a challenge such as communication with mask wearing for those with hearing impairment, and actually stepping up and doing something about it. And, you've seen on Etsy and YouTube ways that you can, make your own. And so the creativity of people through this has been very impressive. Face shields are another option. Certainly they've kind of had, some moments in terms of, recommendation and less so. I would certainly, say, and I think that the CDC stand right now on face masks is that they are an acceptable alternative if you are practicing social distancing. Just using a face shield in and of itself is not really considered to be, truly sufficient unless you have, that 6 feet of distance, or you're using a mask with it in addition. It does have certainly some nice, potential because of its reusability and ease of cleaning it, and the fact that you've got that larger, visual area, which really can help our patients with, the recognition of our facial expressions and lip reading, which we know is so critical for our patient population. So, certainly know that it's a good option to use, especially if you can incorporate, some other aspects such as distancing or the use of a mask. So when we think about, our attire, I think it's very important, especially right now, to be thinking about, what we're wearing to work. Short sleeves is going to be ideal. It's going to help us to more effectively hand wash more frequently without risk of cuffs getting, soaked. Certainly eliminating, ties and neck scarves and anything worn around the neck that has that potential to come in greater contact with our patients is a good idea right now. We should not be wearing, jewelry, especially things like rings and watches and bracelets that can, harbor those bacteria and germs and make it much more difficult as we're doing our copious hand washing to really get rid of those potential germs. If you have the opportunity to remove, office type of clothing before you enter your home, I think that certainly is ideal. Not always, an option, but when you can think about doing that, whether it's clothing or shoes, I think it's important that you attempt to do that. And, maybe considering disposable gowns if you're working with a lot of high-risk patients or, seeing, a need for that extra protection in your community because of, the rate of, positive cases or something, disposable gowns, I think, is a good option to consider. Gloves should be worn in a number of situations in terms of the universal precautions. Certainly, it's always been when there's, blood present, when you're cleaning and disinfecting instruments, when you're submerging them and removing them from cold sterilant. But really, any time that there's the potential for infection to be spread, it is important that we consider wearing those. And I think right now they should be worn in many situations when we are going to have any sort of patient contact whatsoever. There's the right way to wear them and there's the wrong way. They should fit snugly. There should be no gaps at the wrist. We want to make sure that there's very few opportunities for ingress of bacteria and germs. And so if a glove fits loosely like we see at the top, there's the chance for tears and for those little microbes to go squirming in there. One of the things that's important with gloves in our profession is what type of material. Nitrile is safe with impression material. Latex can actually keep impression material from setting up. There's also the risk of latex allergies. And so it's important that you use either non-latex or nitrile gloves in our types of work environments to certainly eliminate the risk of allergy impact as well as impressions not setting up. Just a quick look at how you may develop a PPE use plan for your office for the different activities that you have. What would be appropriate, whether it's dependent on the level of patient contact or not. I think it's good to take a look at your activities and maybe set up a specific plan for you and your employees. Now, PPE doesn't help if we're not wearing it appropriately, and there's some really great educational information out there from the CDC and the NIH. It's important that we make sure that we're wearing it appropriately, and our staff is as well. So education about that is critical. Now, we need to take a look at the type of PPE that we're using, and is it disposable, is it reusable? If it's reusable, how are we cleaning and for that, and making sure that we're using the right type of solution when we are cleaning and disinfecting not only our surfaces but also PPE. But, in terms of soap and water and hand sanitizers, we know that hand washing is critical and really is the first barrier to protect ourselves and others from the spread of germs. And soap and water is, I think, the gold standard, but we know that not every office and not every situation allows us easy access. And so hand sanitizers are considered to be appropriate unless you've got really gross contamination, on your surface. But make sure that you're using a appropriate hand sanitizer. And there's certainly been a lot of discussion lately about some that have harmful ingredients. And so make sure that you are using an appropriate hand sanitizing solution if you are using them. Be careful about what you're touching. We're certainly not supposed to be touching our faces, and that's an easy thing for us to do. In fact, I think it's just kind of human nature. And so, find other ways to, as you can, maybe to open doors with an elbow or whatever, but also be very, very cautious about the touching of your face and your face mask, because you're just potentially spreading that contamination. When we clean and disinfect surfaces, we need to make sure that we are doing anything that is considered to be a touch or a splash surface in our work environment, and that's probably effectively at just about everything that we come in contact with. And there's very specific guidelines about these terms. Cleaning is always that first step. We're just removing that gross level of contamination, and so it should always precede disinfecting or sterilizing. With disinfection, we're killing a percentage of the germs, and so it's not going to eliminate everything, but it eliminates the vast majority. And sterilization should be killing 100% of those germs, and sterilization is pretty much kind of reserved for products that are coming in contact with, blood and bodily fluids. And so that certainly means, curettes, otoscope tips, and things like that are reusable and do have that the bodily fluid contact. They should be sterilized. Now, the CDC and the EPA have really worked on developing material guidelines for disinfection and sterilization, and so there's a link here that the EPA has provided for disinfectants that are approved for use against SARS-CoV-2, which is the same as COVID-19. So when we think about our surfaces, it's important that we are cleaning and then disinfecting surfaces. Hard surfaces usually are easy enough because we can use liquid or hand wipes to do that. One of the things that's kind of come into awareness is the use of UV light sanitizers. I will say be a little bit careful about the use of a UV light sanitizer. Make sure that you have read the directions. They certainly have the potential to be harmful, to us, so they need to be used very carefully. And as with many things, when we have a challenge like this pandemic, a lot of people come out of the woodwork and creating things, and there's not a lot of regulation. In fact, really none at all in terms of these, light sanitizers. So be very, very careful about this, because it's kind of the Wild West right now out there with UV light sanitizers. When you think about soft materials in your office, we certainly want to try and minimize those, for the time being. So if you can switch to hard, surfaces for, seating and things like that, and longer, especially in warm water when possible. If you are using soft surfaces, if you can longer.
Michelle?
Yes.
I think somebody has an open line. I'm going to go ahead and mute everybody. So would you just unmute yourself? We keep dropping out on the audio. So I'm just going to mute everybody now, and then just unmute yourself again.
Okay. Can you hear me?
Yes.
Okay. All right. So we know that our hearing aids and products are made out of specialized materials. It's important that we are using appropriate solutions to clean and disinfect them. And also, as you're taking things from a patient or giving them back to a patient, use something that is lined and protective to make that transaction. Waste disposal, it's important that we think about what we are disposing. If it's something that could be dangerous in terms of punctures, make sure that you are protecting yourself and disposing of the sterilants and disinfectant solutions appropriately, because they're not something you just want to pour down the drain. So here's your second key word, Starkey Cares. Be sure and private message that to your moderator to ensure you get your CEU credit for the day. So think about preparing yourselves, and hopefully a lot of this is something that you've already done in your offices, but there's some great resources out there from the CDC, from OSHA. So if you do need some references in terms of an infection control plan, those materials are out there. We really need to be thinking about, what do we need to do from the patient's perspective to ensure that everything that is part of our service is a safe experience and a positive one for our patients. We need to know that, they're very cognizant of infection control, and they're really going to be looking at what you're doing. So it's important to make sure that, you are performing these, safety tasks and making sure your patients are aware of them. Think about your practice and, make sure that from, the opening of the door to, to the closing, that each of those steps and are part of your phases of service are evaluated. And we need to look at our practices through that COVID-19 lens. It's really kind of changed the way we look at infection control. Make sure you've got signage available so that your patients understand what is expected of them when they come into the office and what they're going to have to do. Make sure you look at your office from that front door inward, do your waiting area. How do you minimize the seating and sign-in and contact materials as much as possible? What do you need to do to protect your front office staff? What do we need to do in terms of, removing that clutter for the time being, or maybe even permanently? And, have you limited people coming into your practice for the meantime? When we think about our treatment areas, we need to look at our ventilation, our traffic patterns, make sure that, we can move about freely without, coming in contact with, as few people as possible. Can we leave doors open? Can we, eliminate that multiple sharing of products and tools throughout our offices? And we also need to be thinking about how we're working with our patients and where we're positioning ourselves. Can we move ourselves so that we are a little bit more at ear level and behind and perform our task certainly safely, but that gets us out of that front line of that face if somebody's going to cough or sneeze or talk loudly. So it's important that we communicate all of this with our patients. What are you doing as a practice to protect yourself and others, and make sure that they know what's expected of them when they come into your offices. They're, certainly going to be looking to see what you're doing and, the example that you're setting. So, as I mentioned, we want to make sure we are demonstrating that, have your PPE, make sure that you have some to share with patients who maybe don't come prepared for whatever reason, but, it's important that we reestablish that trust that we are going to take care of our patients and ensure their safety and health when they're in our workplace. So just a reminder of, Starkey has donated a set of our Livio Edge AI hearing aids. These are amazing products. If you haven't had the pleasure of working with them yet, make sure you visit that auction site and bid on those and the other products that are available to you. And I'm going to turn it over to see if there are any questions that I can answer before the end of your session.
Feel free to unmute yourself if you have any questions for Michelle.
Michelle, I have just one comment. I took Starkey's safety class back in May when y'all offered it online in a seminar, and you all helped me tremendously prepare to open my office and do it in a safe manner and in a way that my patients felt comfortable and, like you said, trustworthy of me, knowing that I was taking care of them and doing everything that I needed to do. And I got a lot of that information from Starkey's seminar. So thank you very much, and thank you for doing this today for us.
Well, thank you, Rebecca. I really appreciate that. And, you know, in the interest of time, I kind of hit in some slides that, you know, Rebecca gives a nice reminder that, you know, we have really worked hard as a company to provide some resources and information on our Starkey Pro website. If you're looking for some guidelines, some signage, we've got a lot of great information there for you. So thank you for that, Rebecca. I appreciate it. I'm glad to hear that those materials were beneficial and helpful for you.
You're welcome.
I'm going to reach out to IHS to make sure that you may receive 2 digital certificates for this event, one specifically for Michelle's, so that will satisfy a Washington State licensing requirement, and then another one for the rest of all the meetings. I'm not sure how they break that out, but I'll reach out to them on Monday